So today we'll continue with our next multiple choice question. Seventh one is Buchner deformity and Swan deformities of the fingers are seen in which all conditions? A. Osteoarthritis, B. Osteoporosis, C. Rheumatoid arthritis, and D is Paget's disease. So what is Buchner deformity and what is Swan deformity? That you should know first before solving this. Buchner deformity is that here the proximal interphalangeal joint is flexed and the distal interphalangeal joint is hyperextended. Okay, so the proximal interphalangeal joint is flexed here in Buchner deformity. The proximal interphalangeal joint is flexed and distal interphalangeal joint is hyperextended. It's like this. Here it is flexed and the distal area is hyperextended. Whereas in Swan deformity, the proximal interphalangeal joint is hyperextended and the distal interphalangeal joint is flexed. Here it comes like this. The proximal interphalangeal joint is hyperextended and the distal interphalangeal joint is flexed. Okay, proximal interphalangeal joint is hyperextended and the distal interphalangeal joint is flexed. So that's happening in Buchner and Swan deformity. I'll repeat once again. What's Buchner deformity and what's Swan deformity? Buchner deformity is that the proximal interphalangeal joint is flexed and the distal interphalangeal joint is hyperextended. Flexed and the distal is hyperextended. In Swan, it is the proximal end is hyperextended and the distal end is flexed. Okay, so this is the difference. This is the Swan. This is the Buchner deformity. So understood the difference? Okay. Good. So it's very important that while reading the question, you should know what is written there. Okay. Then only you will come to know what condition is this and which conditions, which all disease condition happens and all. So the question is Buchner deformity and Swan deformities of the fingers are seen in option 1 is osteoarthritis. What is osteoarthritis? Osteoarthritis is degenerative disease of the joint in which the cartilage which protects and cushions the bones, ends of the bones, wears off over time. Okay. Osteoporosis is weakening and thinning of the bones. Here the bone density and the strength is reduced, so which leads to fracture and all. Third one is rheumatoid arthritis. It's a chronic inflammatory condition of the joints which affects the hands and feet also. And Paget's disease is it's an abnormal disorder of the bones. Here the normal renewing and repair of the bones is not taking place. So what happens is that the bones will become larger, weaker, and ultimately it leads to fracture and deformities and all. Okay. So the Buchner deformity and Swan deformities of the fingers are seen in which condition? Anyone can tell? It happens in rheumatoid arthritis. It's a very important feature of rheumatoid arthritis. Buchner deformity and Swan deformities. I will explain what Buchner is. Proximal interphalangeal joint is flexed and the distal is hyperextended. This is exactly what is Buchner deformity. Whereas in Swan deformity, proximal interphalangeal joint is hyperextended and the distal interphalangeal joint is flexed. Okay, is it clear for you? Yeah, good. So we'll continue with our next 8th question. Enlargement of the thyroid gland caused by the deficiency of iodine. Enlargement of thyroid gland caused by the deficiency of iodine is the question. Options are dwarfism, goiter, Cushing syndrome, Addison's disease. So the first option is dwarfism. Dwarfism means its short structure. It's mainly caused by the genetic factor. It's a genetic factor which affects the bone or skeletal system, or it's also because of the deficiency of the growth hormone. Goiter is the answer for this question. Enlargement of the thyroid gland caused by the deficiency of iodine results in goiter. Okay. Next is Cushing syndrome. Cushing syndrome is the increased amount of cortisol production in the body. Hypercortisolism. Increased production of cortisol leads to Cushing syndrome. Addison's disease is decreased production of cortisol. The adrenal gland it doesn't produce enough amount of hormones like cortisol, aldosterone and all, results in Addison's disease. Okay, so the enlargement of the thyroid gland caused by the deficiency of iodine, the answer is goiter. So next question is protrusion of eyeballs from the orbits sign as a classic finding in Graves' disease. Protrusion of eyeballs from the orbits is a sign of classic finding in Graves' disease. So among these options, we have to see what is the name for that. Okay, protrusion of eyeballs is called as what? Protrusion of eyeballs in Graves' disease is called as what? So first one is periorbital edema. Periorbital edema is nothing but swelling or puffiness around the eyes. Sunset eyes, this is commonly occurring in infants and children with increased intracranial pressure and all. So this mostly we can see in hydrocephalus and all. Next is mixed edema. Mixed edema is due to the hypothyroidism, because if untreated, in severe cases it can lead to mixed edema coma. Exophthalmos. Exophthalmos is the protrusion of the eyeballs. So the protrusion of eyeballs from the orbit sign as a classic finding in Graves' disease is exophthalmos. So answer to this question is exophthalmos. Okay.